Hey, all you YouTubers and future nurses and student nurses. This is Nurse Joe, and I'm just going over ATI Fundamentals for Nursing Edition 8.0, the Content Mastery Series. And I'm not going to go through all the chapters and reading them to you, but what I will do is I will go and I will read from the questions in the back and give you the answers as well, starting with chapter 1. And we're going to move through all the fundamentals chapters, answering all the questions. You guys can read the chapters on your own. I'm personally going to read all the ATI books on my own. But so I'm just going to be going through all the ATIs, all their books, and starting with chapter 1 of fundamentals, healthcare delivery systems. That is the name of chapter 1, healthcare delivery systems. So let's get right down to it. Chapter 1, healthcare delivery systems, application exercises. All right, so question number 1. A nurse is explaining the differences among the various agencies that address healthcare. The nurse should note that which of the following are healthcare regulatory agencies. Select all that apply. A. American Nurses Association. B. The Joint Commission. C. State Boards of Nursing. Or D. National League for Nursing. Or E. Food and Drug Administration. The answer to question 1 is B, C, and E as an A. All right. Number 2, question number 2. A nurse is explaining the various types of healthcare coverage clients might have to a group of nursing students. The nurse should mention that which of the following healthcare financing mechanisms are federally funded. Okay. A, Preferred Provider Organization, also known as PPO. B, Medicare. C, Long-Term Care Insurance. D, Exclusive Provider Organization. Or E, Medicaid. And this time I'm going to actually read the answers to you as well, not just the letters. Okay, the answers to question 2 are B, Medicare is federally funded, and E, Medicaid is federally funded. Question 3. A hospital is conducting a community blood pressure screening in its lobby. This is an example of which of the following levels of care? A, preventative. B, primary. C, secondary. D, tertiary. The answer to question 3 is B. A screening is an attempt to detect an undiagnosed disease at its earliest stage and is an example of primary care. 4. A client in a managed care organization, also known as the MCO, requires hospitalization. Which of the following parties must first approve the admission? A. Emergency department physician. B. Utilization review committee. C. Provider. D. Managed care administrator. The answer to 4 is C. In an MCO, the provider oversees all of the client's care, including hospitalizations. Therefore, the provider must approve the admission. All right, moving on to question 5. A nursing instructor is explaining the various levels of healthcare services to a group of nursing students. Which of the following examples of care or care settings should the nurse classify as a tertiary care? Select all that apply. A, intensive care unit. B, oncology treatment center. C, burn center. D, cardiac rehabilitation. Or E, home health care. The answer to question 5 is A, B, and C. A is tertiary healthcare involves the provision of specialized and highly technical care, such as the care nurses deliver in intensive care units. B is tertiary healthcare involves the provision of specialized and highly technical care, such as the care nurses deliver in an oncology treatment center. C is tertiary healthcare involves the provision of specialized and highly technical care, such as the care nurses deliver in burn centers. That concludes the 5 questions at the end of Chapter 1 in the ATI fundamentals book.